Hi, this is James Frey with Alberta Health Services for Health Matters. Today we're talking to Trudy Reimer. She's a community health representative, and she deals with the Low German Speaking Mennonite population. Now, Trudy, what can you tell us about this population and what sort of services you provide?
So I work with Tina Fielding, and what we do is we translate for this population at healthcare visits, just to better facilitate communication between the healthcare provider and the patient. And we also set up cultural presentations to service providers that are just interested in learning more about this population and how to work with them and just better understand their culture. And we also promote health and health preventative measures to this population. So for example, we have done information sessions on immunizations to ESL groups that this population attends.
Mm-hmm. So what are you finding in terms of the need in this population or in the area?
Yeah, a lot of times they just don't know how to speak the language, so they need help at doctor's visits and such. So what we do is we set up appointments for them, and then we go with them to the appointment and translate at the appointment, or we can even do over-the-phone translation, and then also do follow-up stuff. So we do more phone calls, help them fill out forms that are needed, and also just help them get set up with resources.
What are some other services that you've been able to provide for this population?
Yeah, so a lot of times we just take for granted just the simple things that it's so easy for us to do, but it's hard to do if they don't understand the language or the culture. So we've already been able to set up many families with resources that they wouldn't be able to access by themselves. So for example, we met a Low German Speaking Mennonite father who needs help studying for his driver's license exam. So we went with them to the library, introduced him to the staff, just so he's familiar with the area and they're familiar with his needs. And then even at the library, showed him the many resources that are available for his family to access.
Mm-hmm.
So.
Great. So Trudy, certainly the Low German Speaking Mennonite population, there are some language, cultural barriers, those sort of things that can impede them from getting services, right?
Mm-hmm. Yeah, so I definitely help with that. Like when they come to appointments, oftentimes they don't even understand like the simple difference between a virus or a bacteria or what a cell in your body is. So what I do is just explain those very little things to them. So at these appointments, I just make sure that there's no miscommunication, because oftentimes it's very easy for the doctor to think that they are understanding the patient when really they're just nodding and saying yes because they don't understand. Mm-hmm. So I really facilitate in just making sure that they are getting the care that is needed and that their needs and wants are being voiced and to the doctor.
Mm-hmm. Mm-hmm. Now, for people who want to get in touch with you and have questions, maybe they're a service provider that deals with this population, or there may be people of Low German speaking population that may want to contact you directly. What's the best way to get a hold of you?
So yeah, you can get a hold of me. My number is 403-330-7552, and then my partner Tina is 403-308-8373, and that's probably the easiest way to get a hold of us.
Great.
Yeah.
Great. Thank you very much, Trudy. This has been really helpful, and it's some good information for different service providers in the community. This is James Frey with Alberta Health Services for Health Matters. See you next time.